Hello and welcome to Grand Rounds for the Minnesota Regional Spinal Cord Injury Model System, or as we affectionately call it, the MINSCIMS for short. We want to thank you all for joining us today. MINSCIMS is funded by the National Institute on Disability, Independent Living, and Rehabilitation Research, or NIDLR, to support innovative projects and research in the delivery, demonstration, and evaluation of medical, rehabilitation, vocational, and other services to meet the needs of individuals with spinal cord injuries. MINSCIMS represents an exciting partnership among the following Minnesota institutions: Courage Kenny Rehabilitation Institute in Minneapolis, Mayo Clinic in Rochester, Regions Hospital in St. Paul, and the University of Minnesota in Minneapolis. Our community collaborators include the Minnesota Spinal Cord Injury Association, Unite to Fight Paralysis, Get Up, Stand Up to Cure Paralysis, the Paralyzed Veterans of America, United Spinal Association, and the North American Spinal Cord Injury Consortium. This system collectively provides a multidisciplinary continuum of care for people with spinal cord injury, including emergency medical, acute care, acute rehabilitation, and post-acute services. My name is Dr. Kimberly Mondin, and I will be the moderator for today's session. I'm an associate professor in the Department of Rehab Med at the University of Minnesota Medical School, and I'm a co-project director of the MINSCIMS with Dr. Leslie Morse. A few housekeeping notes. The University of Minnesota has organized the CME for today's webinar. Please see our chat for information on how to record your attendance and claim CME credit for attending this webinar within 24 hours of the event. This meeting is being recorded and will be posted on the MINSCIMS website. Due to the number of registrants for today's webinar, we have placed phone lines on mute, and we ask to reduce audio feedback, and we ask you to participate using the Q&A function. If you have technical or logistical questions, please submit those in the chat to Dan Kelly, and we want to extend a huge thanks to those who work behind the scenes to make these webinars possible. The title of today's presentation is Minnesota Community Organizations and Engagement, Building Bridges. The speakers for today's webinar are Joe Dailey, Joey Carlson, Matthew Rodreick, and Rob Wudlick. I'm going to tell you a little bit about each of our presenters today. So starting with Joe Dailey. Joe was in a motor vehicle accident in November 2002 that resulted in a C5-6 spinal cord injury and quadriplegia. Prior to his injury, he was employed as a project control specialist for Mortenson and is currently the social responsibility coordinator for the company. Having been a marathon runner, he remains committed to fitness, working out at the Courage Kenny Rehabilitation Institute Fitness Center, practicing adaptive yoga, participated in the activity-based locomotor exercise program, and enjoys hand cycling and skydiving. He is a co-founder and executive director of Get Up, Stand Up to Cure Paralysis Foundation, is a member of the Minnesota Statewide Independent Living Council, and is the community liaison for Allina CKRI's SCI program committee. Other hobbies include reading and spoiling his grandchildren. He is also a member of the MINSCIMS Community Engagement Committee. Joey Carlson is a member of the Minnesota Spinal Cord Injury Association Board of Directors who brings his expertise in marketing and dedication to volunteering. His educational background includes a Bachelor of Arts from Osberg College and an MBA from the Carlson School of Management. He has worked in marketing for Medtronic, UCare, United Health Group, Target, and the Minnesota Timberwolves. His previous volunteer roles include serving on the board of directors for the Greater Minnesota Speed Skating Association and advocating for patients with AdvaMed in Washington, D.C. Joey has a C5-6 level spinal cord injury, and you can find more about him at joeycarlson.com. He is also a member of the MINSCIMS Community Engagement Committee. Matthew Rodreick entered the SCI community after his son Gabriel sustained a C5 injury while body surfing in Costa Rica. After leaving his position in emergency department management in the Fairview Health System, he and Gabriel traveled the world in search of therapeutic options, only to end up back in Minnesota advocating for restorative research. Matthew led a coalition of Minnesota SCI community advocates, clinicians, and researchers to leverage the state legislature in pursuit of targeted public funding for SCI research. Since joining Unite to Fight Paralysis in 2015, they have passed similar legislative initiatives in Washington. I'm Canadian, so the state acronyms I might get wrong. Pennsylvania and Ohio, and continue to work in Wisconsin, Texas, and Colorado. He credits Unite to Fight Paralysis and the annual Science and Advocacy Symposium with providing the knowledge, connections, and focus to expedite novel restorative treatments for paralysis from SCI. As executive director, Matthew has overseen the implementation of a number of new initiatives, including Unite to Fight Paralysis CureCast podcast, the Lab Rats initiative, placing SCI lived experience consultants in SCI research labs across the US, several working groups of researchers, clinicians, SCI foundations, and industry working in neuromodulation, translational research, and activity-based therapy. Matthew has delivered presentations at Asia, SFN, Neurotrauma, NIH, and many other SCI-related meetings nationally. He is also a member of the SCIMS Community Education or Community Engagement Committee. And we also have Rob Wudlick joining us today. Rob Wudlick, has been quadriplegic since 2011. He has been a driving force for spinal cord injury research and disability rights in Minnesota and a community advocate at the national level. He helped devise and push through novel legislation to fund SCI research in Minnesota and has worked with advocates from other states to assist them with similar efforts. In 2014, he was a founding member of the Get Up, Stand Up to Cure Paralysis Foundation. Currently, he is working to advance medical research for spinal cord injury and is the clinical trial research project manager in the Rehab Med Department at the University of Minnesota. He also owns and operates Dept Design Works LLC, a company that designs and develops assistive technology products. He's also a member of the Minnesota SCIMS Community Engagement Committee. You are all a very accomplished group, so thank you for joining us today. Welcome to all of you, and thank you for presenting. And I will hand it over to you all. Oh, I think you're muted, Joe.
If you could go to the next slide, Kim.
Sure.
So Get Up, Stand Up to Cure Paralysis Foundation has a vision of a world in which paralysis from spinal cord injury is curable. Our mission is to unite, educate our community, support and advocate for the restoration of function in spinal cord injury. Next slide, please. We are a nonprofit organization in Minnesota. Again, just to reiterate, we were founded in Minnesota by a group of us with spinal cord injuries. Next slide. Founded in 2014. All board members are directly connected with the SCI community, either living with an injury, are a caregiver of someone with an injury, or a family. More than 750 people are impacted by our communications. Next slide, please. What we do, we offer a monthly peer/caregiver group that meets the first Saturday of every month from 3 to 5 p.m. We meet in person at Courage County in Golden Valley, but we also meet over Zoom. We do individual peer mentoring. We have a Women Standing Strong group, which is a women's family care group. We do advocacy outreach events, and we're dynamic to the needs of the community. Next slide, please. One of the key things that we offer is an adaptive fitness scholarship. As I had mentioned, fitness is a key part of what GUSU stands for. And so that when restorative therapies become available, we want people with spinal cord injuries to be ready to get those. So in part, we offer 4 $2,500 scholarships annually to applicants living with an SCI in Iowa, Minnesota, North Dakota, South Dakota, and Wisconsin, but the funds need to be used in an adaptive program in the state of Minnesota. Next slide, please. Towards our education focus, we published in 2020 the Upper Midwest Spinal Cord Injury Resource Guide, also lists resources in the 5-state region to share information that we've learned to maybe ease the burden of those with a new spinal cord injury. Next slide, please. Matthew alluded to this, but the beginnings of the SCI TBI research began in Minnesota, was enacted in 2015, where we got $500,000 per year. In 2017, that went up to $3 million a year. So funds are split equally between SCI and TBI. Next slide, please. So the SCI TBI research program has funded more than 20 research projects in Minnesota, funding everything from basic cellular science to human clinical trials. Next slide, please. Other events, we have, I mentioned, the monthly peer group. We're doing a peer group cookout in July, which actually is going to be expanded to be a collaborative between GUSU, MNSCIA, and SCIMS. We hold an annual fundraising event every September during National Spinal Cord Injury Awareness Month. And we partner with Minnesota Spinal Cord Injury Association on a number of things. Next slide, please. And that turns it over to Joey Carlson.
Hi, everyone. My name's Joey Carlson, and I'm on the board for the Minnesota Spinal Cord Injury Association. And as you'll see, even though GUSU and all of these organizations are separate, we work together on a lot of stuff. So it's we're really partners together. So the idea of the Minnesota Spinal Cord Injury Association is to connect, to advocate, and to educate. And I'll go through a little bit about how we think about ourselves. The next slide. So the mission of the Minnesota Spinal Cord Injury Association is to enhance the quality of life for individuals and families affected by spinal cord injury in Minnesota by connecting members to the resources they need and filling gaps where appropriate resources do not currently exist. So kind of the way you can think about this on the next slide, you have, look at the bottom, so you have someone, you can think about someone who has a new injury or someone who has a new problem with their injury. What they can do is they can reach out to the Minnesota Spinal Cord Injury Association. And then we would work as a hub to find them where they need to go to get their question answered, or or the resource they need. And then we also meet and review all of the inquiries we get, and we try to fill any gaps in that we've seen throughout the years, or we do our best. We're all volunteer nonprofit board. We do our best to try to fill gaps where they're needed in Minnesota. And one way they can do this is we've just made a lot of connections in the community, so they know to reach out to us. But we also have an Ask an Expert feature on our website. So we'll get a lot of questions where people can click on a button on our website and send us in questions, and we'll get back to them within a week. So they can find us on Facebook and on our website at mnscia.org. You can go to the next slide. And then one way we try to get more involvement with the community is meeting with these other organizations. So we have our monthly peer groups that Joe talked about. Actually, on Saturday, we have an exciting peer group. We're doing our our adaptive video game day at Courage. So if anyone knows of anyone who wants to learn about all the adaptive equipment available for people with spinal cord injuries, we'll meet from 3 to 5 on Saturday and go through some fun stuff. We've also done pizza parties, happy hours, and then we'll do a few annual events and just try to get everyone together, and we do our best. It's been hard through the pandemic, but we're trying to get back on track so we can get more people together. You can go to the next slide. So we have also the local chapter of the United Spinal Association. So you'll see in this picture here, we have me and Amy Klobuchar and Rob, who you'll meet in a bit, and then another guy named Thomas. And so we have gone to DC every once in a while, and we participate in national events. We have the Roll on Capitol Hill, and then we also have leadership meetings where we learn about national issues affecting people with spinal cord injury associations or people with spinal cord injuries. So United Spinal's vision is they envision a world where people with spinal cord injuries can realize their full potential and live life at its fullest. So I guess that's a little bit about the Minnesota Spinal Cord Injury Association. Like us on Facebook if you want. So, Matthew's up next.
Thanks, Joey. Hi, I'm Matthew Rodreick. I'm the Executive Director of United Fight Paralysis. We are a national grassroots organization that's based here in Minnesota, and that is our mission statement that you see there. Kim, you can go to the next slide, and we're going to do something a little different. You're just going to watch a video for about 1.5 minutes that describes who we are, what we do. Go ahead and click on it, Kim. Thanks, Kim. And I just want to make one little quick note. Our staff in Minneapolis is a little different, but that's the only photo I had. So there's a couple of folks that are new, including Jordan Bolton, Lucia Webb, and Kathy Christofferson, who we've added in the last couple of years. But fundamentally, as you'll notice, you see a lot of the same people in photos and slides. You you'd think this is a kind of incestuous community, because it is. We do work together, as Joey said. So you saw Rob and Thomas and Joe and a number of us who have been working together for many years. And it's one of the strengths within the spinal cord injury advocacy community in Minnesota. Go ahead, Rob. I think you're up next.
Hi, I'm Rob Wudlick. And so, yeah, I'm part of GUSU. I've been part of Unite to Fight Paralysis. And, you know, in the Minnesota community, we've really done a lot to advance community activism and engagement in the greater spinal cord injury community. And we're proud of that. You know, and I think it led to some of the success of creating the Minnesota spinal cord injury model systems. And, you know, our vision has always been to bring people together. And this is another platform to do that. And it's really great to be able to have a voice with the clinicians, the researchers, and be integrated into this system as well, which is kind of innovative and groundbreaking for the national model systems. And so, you know, really our driving charter is to bring forward, guide, and be the liaison for the community of the spinal cord injury experience and improve clinical care and research in the Minnesota spinal cord injury regional systems. You know, this community is not only focused on people living with spinal cord injuries or their families, but we also want to include clinicians and, you know, government, anybody, payers, anybody that's related to this experience or has a foot in the game. So, yeah. Next slide. Yeah. Yeah. So what we do, we primarily, we advise the model systems. So, you know, the model system in general, if you're not familiar, it's composed of a research arm, a data collection arm, a clinician arm. We're one of those arms is the community advisory board. And, you know, we want to really bring every voice together that has some kind of opinion to kind of, you know, focus on the research, but also the care and community outreach. So, you know, and expand on our diversity, equality, inclusion. We also want to provide community integrated education to our spinal cord injury community and providers. And that includes the greater provider system. I actually had lunch with was barbecuing with the ER doc last week who didn't know what an ASIA score was. And, you know, it turns out he really didn't know much about spinal cord injuries at all. And so it's, you know, we really need to do a better job at getting this kind of communication brought forward across the greater medical community. You know, understand and communicate the interests and needs of our community. You know, and these needs change. So we want to be able to, you know, vocalize and be part of that, bringing that, you know, communication across faster to the people that need to hear it. We also want to, you know, lead and participate in integrated research. That's something that, you know, our larger partners with Lab Rats, with Unite to Fight Paralysis, NASCIC, has also created a education course. And, you know, this is something that we, you know, I live and breathe every day. This is the job I do. So, and, you know, provide guidance to the national model systems and advise. And we also, you know, we're having the barbecue. I hope you guys, you know, everyone in the model system is welcome to attend and encouraged next July. And yeah, any ways that we can help people that aren't getting help they need in our community too, including rural and urban healthcare settings and community. So next slide. Yeah, we have a few projects that we've done so far. We've kind of embarked on this creating an educational webinar series. We did do kind of like a mini survey before doing that to kind of assess what the gaps are from inpatient care to community living. And this kind of word diagram, transitions to home, insurance, rehab, bowel bladder, self-care, we're kind of some of the higher needs, but you kind of can see some of these words in here that, popped up, things that keywords that were repeating in kind of that survey results. Finding home care is a pretty tricky thing too. We also help researchers in doing research support. So we want to connect our members to anybody seeking research, community assistance with research, or community advisors or letters of support from our advisory board. And next slide. And, we're always, our board is an open board. You can join anytime if you're interested. Right now I'm the committee director. You could also go to this, we have a red cap survey here. I'm sure that's easy to copy and paste, but not really. But it's also on the Model Systems website. So, but yeah.
Could you put that link in the chat, Rob, when you get a chance?
Yeah.
Maybe that would be great.
Yep. Well, thank you.
All right. Well, thank you, Matthew, Rob, Joey, and Joe. Thank you for presenting today and talking about all the work that you're doing in the community. And I also want to thank you guys for collaborating with us and being a big part of the Model Systems. And I'd also like to introduce our discussant for today, Dr. Amanda Derasmi. She is a double-boarded PM&R and spinal cord injury medicine physician, and she currently practices at Courage Kenny in Golden Valley in both the outpatient and transitional rehab program setting. She's been practicing OMT for the last 10 years as part of a holistic approach to patient care. And she is also part of our Minnesota Regional Spinal Cord Injury Model System. So welcome, Dr. Derasmi, and thank you for joining us today.
Thanks.
Hi, Mandy.
Hi.
Thanks for being
So
here.
Thanks. So is this my time to ask questions?
It
Yeah,
is.
or just give your
my-
sort of
my 2 cents.
perspective, yeah, on community engagement, maybe how you've involved the community in your work. I mean, I know you work directly with patients, but maybe to inform some of your research or your work. And then there was a question in the Q&A that is open to all of you to answer. Someone asked that as larger institutions, U of M, Allina Health Partners, et cetera, how can we better partner with community organizations? Where are the gaps and what aren't we doing well? Some food for thought.
And that's a big question. I will just kind of give my brief overview. The reason I ended up in Minnesota was actually because of how we are set up and funded here, and because of Courage Center and it's linked to the community, because it's not that way in every state. And so I'm very happy and proud of the communities we have here, because it's important. It is not something that you can do alone from an outsider's perspective. Certainly those with injuries can give you more insight into that. For me, I helped form a women's group. And so at Courage, on every third Saturday, we have a group of women with spinal cord injuries meeting. So for me, that's been very fulfilling. I really enjoy women to connect with each other. And then other than that, I've gotten to meet most of these gentlemen in one way or shape or another in different forums. And I think it's wonderful that we're continuing to build on what's been here and then with the model systems. So that's about it.
Fantastic. Thank you. Rob, it looked like you, I can't, there
I
we
was
go.
just clicking on buttons.
Oh, okay.
Yeah, but no, I think, I think that, reaching out to any 4 of these organizations, is really good. This is, our plugging in the Minnesota Model Systems Advisory Board. This is a good start. And I think, I know Allina and Health Partners kind of have this, spinal cord injury care kind of team and meetings. Joe Dailey's on the Allina one, I know. But I think just kind of, it's a mix of clinician engagement, but also leadership too, that, requires these changes. And, I think one of the big things that we've struggled with as a community member is trying to make that transition home better, and the kind of short and long-term community needs, just getting those things met. And, they typically aren't covered by insurance, which is hard from a provider perspective. But yeah.
Yeah, I wanted to touch on one thing. I know for each of these organizations, it's true, it plays out differently. So Unite to Fight Paralysis is explicitly focused on advancing research towards treatments, innovative, novel treatments that would restore function. The other organizations have that as a feature as well, but are more resource-based in some sense. But I think what I wanted to say is across the board, and when I'm starting to type in the answer to the question that was posed, is each of these organizations are promoting and supporting relationships within the community, as a sort of resource and support, but also relationships to institutions, relationships to larger organizations, and relationships to larger efforts. So in the question, there's I'm starting to answer is, it really depends on, are you asking how the institutions can do a better job in clinical practice relating to the spinal cord injury community, or better in terms of its research effort in terms of improving clinical practice or improving research efforts towards restorative therapies. But in both cases, relationships are the critical piece. And that's what I think, that's why we all wanted to be here, to offer ourselves in relationship to others.
I want to add on to what Matthew said there. Well, with regard to Get Up, Stand Up to Cure Paralysis, our 3 focus areas are education, fitness, and research. And most, if not all, of our research is dependent on Unite to Fight Paralysis. So we funnel our research dollars to Unite to Fight Paralysis. So again, as Matthew alluded, that's how that part of the community works together. With regard to institutions, get us involved at the beginning. I know that Courage Kenny reaches out to me quite often as to be a peer visitor, a peer mentor. Regions Hospital has also reached out to me, though it's been a while, to do peer mentoring there. Not sure what program is in place in Rochester, but that is the key involvement of us in the beginning of the spinal cord injury. And oftentimes the newly injured patient is not ready to see someone who's thriving with an injury, because they may still be in that denial mode. And I think this is where SCIMS and the institutions can be involved, is let that inpatient know that the resources are there. And when the time comes that they're ready for them, we have at least done that communication.
And another thing that gets people, like the community together, along with the researchers, the newly injured people or people who aren't involved, they get excited about the research and new advancements. So that's a lot of times how people get involved early, is they're excited about new advancements. So, and working
And-
toward those. So,
And to tack onto that, Joey, they're often champing at the bit to be in clinical trials. So if you have clinical trials that are going on, let's let people know, because they want to be a part of that.
We with GUSU and MNSCIA, we do offer peer mentoring, and we're trying to re-up this, kind of make our list wider and more diverse now through the model systems too. So any one of us reaching out to any of us will, for a peer mentor, if you have a patient, and that's also a tricky thing, because we want to help people. But I know myself, when I was early in on my injury, I didn't want to meet peers. And so it's kind of at a certain time, but it is a valuable, it's these peer groups, the peer mentoring, you learn a lot more than you do in some of these education courses in pretty quick time. So.
Right. Matthew, there's a question for you in the Q&A. Can you talk more about working to walk and opportunities as a community and MnSCIMS to attend or be involved?
Sure, for certain. So if you were noticed in the video, one of the things that we do is an annual science and advocacy symposium that we move around the country. This year it's in Minneapolis. It used to be called Working to Walk. It is no longer. It's called the U2FP Science and Advocacy Symposium, a little more dry, but it'll be a great opportunity. As I mentioned, pretty much everything we do is really at its root driven by an attempt to improve the relationship between the people who live with the injury and the people who research and treat the injury. And so this meeting is a great example of that. We've been doing it for 18 years. We bring many of the leading scientists in spinal cord injury to this meeting, many of whom you probably know. And this year, our title sponsor is the University of Minnesota, the Rehabilitation Institute, or what's the term, Kim?
The Department of Rehab Med?
Thank you, Department of Rehabilitation. For some reason, I have institute stuck in my
That's
head.
okay. That's okay.
They're our title sponsor, and there will be presentations from folks at the University of Minnesota, from the Mayo Clinic, also from around the country, both in research and funding of research, from industry, asking a lot of questions about what we refer to as the larger research economy. It's kind of the whole system of academic research and funding, public and private, and how industry plays a part. And really at the heart of it is looking at it through the lens of the lived experience of spinal cord injury. What does it mean for people who live with spinal cord injury? What is realistic? How can we become involved? How can we influence the incentives and priorities of that research economy to get what it is that we in the community want? So thanks for the question. It's a great opportunity. I hope many of you will come. Our meeting will be on October 20th and 21st at the Minneapolis Hilton in downtown Minneapolis. There should be lots of folks there. People with spinal cord injuries go at half price. It's already a relatively cheap conference. It's $195. Half that if you have a spinal cord injury. If you have a caregiver in attendance, they go for free. And for anyone who lives outside and needs to travel here, we do offer travel grants, which will open up sometime in the next month. The Nielsen Foundation and Global Technologies have both committed dollars to offer us travel lodging scholarships for people from the community to go. It's a very sciencey conference, But again, it's through the lens of spinal cord injury. And it's the only one that I'm aware of that's as well attended by people with spinal cord injuries of any of the conferences around the world with spinal cord injury. So I hope you all can make it.
That's fantastic. Are you able to put a link or anything in the chat for
Sure.
people? That would be great. I don't see any questions in the Q&A right now, so I thought I would pose a question. So in the last probably 5, 7, 8 years, you know, there's been a lot more literature based on, you know, engaging people with lived experience in the research process. We know a lot of the work being done in Canada on the integrated knowledge translation principles. You know we need to engage people with lived experience early and often throughout the research process. What do you want researchers to know about engaging the community, and what should we have a lot of room to grow. I think we're all sort of learning our way through this. But what do you want us to know, and what could we maybe do better?
Well, I'll jump in because one of the other things you may have noticed is that we launched last year something we call the Lab Rats Initiative, where we've been placing lived experience consultants into research labs on an ongoing basis, and also on specific projects, you know, a granular project that might last for a year, 18 months, and then move on to a publication. Again, this is kind of redundant, but I keep using the word relationship, but that's what we focus on. That's what we talk to investigators and lab staff and, you know, trainees, that this lives or dies based on the relationship that you can cultivate. And I guess what I would say specifically to researchers or research clinicians is to remember that there is an expertise to having lived through a spinal cord injury, specifically for someone who has a spinal cord injury, and to some degree also for someone like me who has a child or a spouse or a sibling or parent with a spinal cord injury. To the degree that they have been intimate with that experience, it is an expertise that you don't have, and that is necessary for you, especially on that continuum. If you are in an environment where you are trying to apply something, whether it's learning something about how to improve clinical practice, or whether it's trying to translate a novel therapy, that expertise becomes extremely critical in understanding how it will be received, how it will be understood and experienced by those who live with the injury. So that would be my encouragement.
I want to tack onto that, Matthew, and also tack onto what Rob talked about with the emergency room physician not knowing anything about spinal cord injury. When I was injured, my sons were 14 and 16. My one son is now a paramedic, and basically he says that's my fault because he had to take care of me with a spinal cord injury. So he is one of the very few paramedics out there that is educated on spinal cord injury and what autonomic dysreflexia is, et cetera, et cetera. I know that Allina has taken strides in educating their paramedics on what different things to look for in people with spinal cord injuries. So that's another area where we need to educate. I mean, not only our ER docs, but down to our paramedics in the field, what they need to look for when they're dealing with someone with a spinal cord injury. Whether it's a new injury that they've just come across, where the guy flipped his motorcycle or his ATV and dived. That education piece needs to happen for paramedics, in addition to how do I respond to someone that's living with a spinal cord injury and they present with autonomic dysreflexia, and they don't immediately say, oh my God, his blood pressure's going out of whack. You know, we need to find the source of that. So that's another education piece that the institutes can help us with.
Right.
Yeah, you know, I do want to comment. I think, you know, engaging people with lived experiences in spinal cord injury or whatever research you're focused in, earlier is better. I mean, when you're coming up with a concept, that's the best time, but it's never too late to, you know, I work with Kim, I work with Dr. Morse, Mandy and I just wrote a grant too that, yeah. And, you know, I think, you know, it's the more engaged that I think it contributes more to like the outcomes and meaningfulness that will impact the community more too. And also logistics, and when you're writing that, you know, when you're writing or the publication even to the, you know, it's, well, what's the outcomes? You know, you might think that, oh, you know, this little thing is really so cool. And it's like, it's a really cool science thing, but really you discovered something huge over here that like, that actually means a lot more to somebody living with the experience. And, yeah.
Great. Thank you. I don't see any other questions in the chat at this time. Did you guys have any other comments or pearls of wisdom?
Yeah, I was just going to add one little, it's delicate. You know, everybody here probably saw the media blitz of headlines coming out of Switzerland and the Nature headlines recently. And you know, I would encourage anyone, not to be self-serving, but our science writer just posted a piece to kind of unpack those headlines just yesterday. Sam Maddox, who's been writing about spinal cord injury for 40 years, really thorough piece, kind of unpacking the headlines. But the reason why I wanted to bring it up is in line with this conversation. You know, it's a cool story. It's a cool scientific advance. But there's real problems with the frame around it. And particularly the headline of paralyzed man naturally walking, right? There's a bunch of things layered in there that I think are germane to this conversation. One of them is obviously naturally walking. What is that? What is that? And I wouldn't call it naturally walking myself. But the other is there's a subtext of that that's ableist. And the subtext is all the clickbait packed into that is about walking. And not to say that walking isn't important, and also that spinal cord injury is a whole body system, that walking solves a lot of problems that people with spinal cord injury address, but it's this shallow perception that walking is the end all be all, and walking is what everybody wants more than anything else, which is just not true. And it's really important to be able to hear from the community, hear from people who have spinal cord injury, to help interpret for you or for your friends, for your community, and even in the clinical setting, how that is received, how that is heard, how that is understood through the lens of people with spinal cord injury. So I just want to mention that, like that's just because if any of you are like me, you know, I probably got 24 messages when that report came out. And of course I go on social media and there's people left and right, like, I'm flying to Switzerland. When do I get my BCI? Like all this crazy stuff. And people just don't understand what it means scientifically, what the details are. But there's also this subtext that's very misleading and almost deceptive in terms of how the story is carried.
You know, when I was reading through, you know, some of the articles that were coming out, and, you know, the typical kind of headlines, right? And then when they were quoting the researchers, and you could see the researchers trying to sort of like scale it back, like this was one participant, we are years away, it's sort of, it made me feel uncomfortable reading it. I had this like dissonance, yeah.
Yeah.
Well, the real, one of the things that Sam touches on, and I know plenty of research clinicians actually who are planning to write letters to Nature, is the coverage of patient profile was not well done and almost unethical. This person was already taking steps for years, had a stimulator implanted 4 years ago, prior to this new intervention. That is really important detail that a lot of people don't understand. And again, that's the way this larger system of media hype and journalistic headlines work. And that's just the way it works. But again,
Right.
having a perspective from the spinal cord injury community specifically, it really helps to sift some of that.
Yeah. Yeah, and it's a tricky balance because you don't want to raise expectations and get people's hopes up that it's right around the corner versus this is a small step it's a small step in the right direction, but it's
cool science, right? Say it's cool science. And kind of leave
And
it.
if you see the headline too often, that's kind of false. Then you kind of get to it. So
it's starting to crawl wolf if you see it every year, and then there was a question about walking, locomotion versus kind of the secondary complications. And I think, we all understand that, at least in this small group here. But, I think the things that make the headlines, publicly beyond the spinal cord injury community, including everyone here on this call that's listening, it's a matter of, what people see, and that's somebody in a wheelchair with a spinal cord injury. They don't see the ball bladder, so that's more relatable, I think, publicly. And it's hard to communicate these things. So, but equal importance. There's the Mondin survey, Mondin publication. Then about a week or two ago, there's a new survey published on community perspectives on spinal cord stimulation. That also has a revised kind of community needs on community needs assessment on what people want. So,
I want to add also in comment to the two comments in the chat, and to add to what Rob said. Yes, there's quite a bit of heterogeneity in how people present with spinal cord injury. There's no single spinal cord injury is the same as another, right? All C5s are not the same, right? Or T4s are not the same. But there's also a lot of variability in what people want. And so this kind of nuance, but the two things that I think about a lot are, one, we have to, in the community, and I think also the research and clinical community, have to be really careful that we don't stay in a place of scarcity, that it forces us to pick which child we're going to sacrifice, right? Everybody with spinal cord injury wants everything back and should have everything back. Our mission, and as was everybody's here, live life to the fullest, no barriers, cure spinal cord injury, restore function. We all want everything back. I want everything back for my son. And we don't want to be forced to say, well, if you had to pick one thing, like, what is it?
Right.
Well, no, we want it all. But at the same time, you do have to do some kind of patient preference or some kind of, understanding of what can we do now? What can we do? What fire can we put out now, sort of. But that patient preference thing, and this is also nuanced, is really difficult to put your finger on, because the same people that you might survey now, 5 years from now, it's going to be different. 10 years from now, it's going to be even more different, because
So,
Some newly injured might want walking, and 5 years from now, it's like, well, the wheelchair's fine. I need my bowel and bladder function back. And
right.
so it's a really complex and nuanced problem to address in our community and for you all on the research and clinical side.
Thank you. And sorry to interrupt you, Matthew. We are getting close to the end of our time here. So I just wanted to thank you all again for joining us today and giving your perspectives and presenting. And thank all of our attendees for joining today as well. We apologize if all of your questions weren't answered in the Q&A, but you can definitely reach out to each of the presenters individually if you have any follow-up questions. And our recording will be posted on our website as well, which is here on the slide. We posted on our YouTube channel. Let's see, as a reminder, see the chat after the webinar closes. There will be a brief 3-question survey that will pop up on your screen, and we would really appreciate your feedback so that we know that our grand rounds are hitting topics that are of interest to people who attend. So thank you all for joining us and have a great rest of your day. And thanks again to the presenters.
Thank you.